afternoon, everyone. We are so excited to be here today to talk about health and wellness in the anti-trafficking movement. My name is Deborah Foote. I am the president of Voices for Florida. My professional life has deep roots in providing long-term care services to vulnerable populations and health coverage advocacy. So I'm very excited to be moderating this panel and exploring this topic. We have an incredible group with us who will share their diverse expertise on this topic. A quick flag for all of you: resources will be made available after the webinar, as well as a certificate of completion. One last note before we begin: the opinions and perspectives of the panelists do not necessarily reflect the viewpoints of Voices for Florida. And without further ado, let me introduce you to today's panelists. Dr. Sarah Helms is a clinical psychologist who lives in Greenville, North Carolina. She currently provides therapeutic and mentorship services through the Daughters of Worth nonprofit organization, serving girls and young women with otherwise limited access to mental health care. Sarah also co-facilitates virtual therapeutic and support groups for survivors of trafficking and commercial sex exploitation through the Avery Center in Colorado. She has specialized in working with survivors of sex trafficking for the past 5 to 7 years, and her work emphasizes a strength-based, trauma-informed lens. She focuses on seeking shared power and collaboration to support her clients' growth and resilience, particularly following trauma and relational stressors. When she isn't busy with her professional role, Dr. Helms enjoys spending time with her husband, 2 children, and her mini dachshunds, with numbers varying depending on how many foster pups she has at every given moment. Welcome, Dr. Helms. Jessica Donnelly is a licensed and NCCAOM board-certified acupuncture physician. After completing an associate's degree from psychology from Indian River State College, she continued her education studying Chinese medicine. Jessica received training at the Florida College of Integrative Medicine, where she graduated cum laude with a bachelor's degree in professional health studies and a master's degree in Oriental medicine. Practicing since 2008, Jessica has gone on to further her clinical knowledge and experience through advanced certifications and training. Those accomplishments include certification in neuro-emotional technique, certification in acupoint injection therapy, and she is trained in National Acupuncture Detox Association Protocol, Meizen Cosmetic Acupuncture System, and auricular acupuncture. After practicing for 8 fulfilling years at an established center in Vero Beach, Florida, Jessica relocated to Northeast Florida, where she established Grace Love and Acupuncture. It was in Jacksonville where her love of working with survivors of human trafficking was born. Her practice grew to have a strong focus on healing trauma, utilizing alternative and ancient techniques. Jessica currently resides in Savannah, Georgia, and is eagerly awaiting her Georgia acupuncture license. While Jessica is passionate about helping others, her greatest love is her family. She is married with 3 young children, and as a family, they enjoy days on the beach, dance parties in the kitchen, spending time outdoors, puzzles, and building sheep forts for movie night. Welcome, Jessica. Years of debilitating back pain and an increasingly stressful lifestyle encouraged Shiva Thompson to begin her yoga journey in 2007. She quickly realized that yoga is more than just a tool to decompress the physical body. Yoga is an integrative science that not only heals the body, but also clears and purifies the mind. This inspired her to delve deeper. While living in Dallas, Texas in 2018, Shiva made a 9-month commitment to Manifest Your Inner Teacher, a 200-hour yoga teacher training course. This journey was led by Barb Totsky and Duka Lekot, who poured into the aspiring teachers a wealth of expertise in yoga styles, including Vinyasa, Yin, Iyengar, Restorative, Tantric, and Hatha. After nearly a year of intense introspection, Shiva earned her 200-hour registered yoga teacher Yoga Alliance certification. Drawing from this experience, she weaves compassion, inclusivity, breath work, and self-awareness into her classes. Her teaching style is a healing fusion between hatha and slow flow vinyasa with sequences that touch body, mind, and spirit. Shortly after earning her 200-hour registered yoga teacher certification, Shiva moved to Jacksonville and discovered Yoga for Change. She instantly fell in love with their mission and joined the full-time staff in May 2019. She is inspired every day to facilitate access to trauma-informed yoga for marginalized communities and is grateful to witness how students' experiences translate into leading a more meaningful and joyful life. Welcome, Shiva. Bradel Canfield was naturally drawn to helping girls overcome trafficking in 2017 when she began as a volunteer at Project Gold, sharing her skills as a yoga teacher by teaching weekly classes for girls. Soon thereafter, she accepted the first full-time survivor mentor position at Project Gold. She was later promoted to program manager and has developed a survivor mentor department to mentor girls in the program. Creating a survivor-led program that encourages members' healing, success, and leadership skills, Bradel continues working to develop innovative programming to further develop and best serve youth who've been commercially sexually exploited. Welcome, Bradel. Dr. Mollie Golden is an associate professor in the Menninger Department of Psychiatry and Behavioral Sciences at Baylor College of Medicine in Houston, Texas. She completed medical school and residency at Barnes Jewish Hospital at Washington University in St. Louis. At Ben Taub Hospital, she is clinical faculty and the associate director of the inpatient psychiatric unit, where she supervises residents, medical students, and a team of interdisciplinary providers. She cares for adults with acute exacerbations of chronic mental illness, many of whom are vulnerable and marginalized. Her research background is in pharmacokinetics of dopamine-dependent disease pathways and the trauma of individuals who suffer from these conditions. She has worked with survivors of the 9/11 terrorist attack to reintegrate them back into the workplace. In 2016, she participated in the development of the first fellowship in the mental health impacts of human trafficking at an academic medical center, where she is medical director of this program. She is a co-chair of the American Medical Women's Association Physicians Against the Trafficking of Humans, where she leads the Train the Trainer workshops nationally. She is on the HEAL Trafficking Speakers Bureau, has testified for the National Advisory Council for the Office of Trafficking in Persons, and lectures at national meetings on human trafficking. Recently, she founded the Baylor College of Medicine's Division of Global Mental Health to treat survivors of torture, trafficking, and mass violence atrocities. She has won numerous papers in the field, edited a book in this space, and won numerous awards for her work. Welcome, Dr. Gordon, and welcome to all the participants today. All righty, while you're all doing such amazing work, I really want to thank you so much for being here today. Let's start the conversation with the World Health Organization definition of health. They define health as a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. So to all of you, how do each of you define or view health and wellness in your work with survivors of trafficking and complex trauma? Who'd like to kick us off?
Yes, I'll start things off.
Thank you, Shiva. Dive right in.
Of course. So my name is Shiva Thompson, and I'm a program director with Yoga for Change. We're headquartered in Jacksonville, and we provide trauma-informed yoga to 4 populations, and those include veterans, individuals that experience incarceration, youth, and those living with mental health conditions. And that last category encompasses survivors of trafficking as well. So with our mission to provide trauma-informed yoga, I would say health and wellness is about the healing journey from the trauma that's been sustained by reconnecting mind and body. So what happens when trauma occurs, that connection between mind and body is severed, and that's a survival mechanism, and it serves its purpose when the trauma is sustained, but it can be really devastating after the fact if that connection between mind and body is not restored. And so this is where mental health is greatly impacted to where, for example, an individual's sense of self-worth might be tied to the trauma that they've experienced. So a lot of times survivors of trafficking, they're not comfortable with being or just even existing in their own body. And this is where trauma-informed yoga is one tool that an individual can use to help them confront the trauma that's been stored in their body and work and address that trauma on their own terms and on their own time in a safe way. And this is where the healing really begins. So that's my take on it. Passing the baton to whoever would like to take a stab at it next.
I'll hop in. I'm Sarah Helms. I'm a clinical psychologist. Deborah, thanks for the introduction. Yeah, Shiva, I agree. I think that's a great response. For me, I think when I hear the World Health Organization's definition, intuitively, that really makes sense to us, I think, when we're thinking about ourselves, right? When you're thinking about the difference between being sick versus being well. And so when I think about this from a trauma-informed lens, from a therapeutic lens, I'm really thinking about my role with an individual is not to remediate or solve some sort of a deficit. My role is really to lean into a strengths-based approach to foster growth, to think about, where do you as a participant in this relationship want to build, create, grow, change, and how do we work with your strengths in order to move into that space of forward thinking rather than, well, there's a problem and we're going to fix the problem, which I think is the sort of flip side of that, the alternative to that health organization's definition. So for me, kind of leaning into that definition and really thinking about how does this apply in the way that we approach every step of the work around just seeking wellness, not seeking to remediate illness. I think that's my answer.
Would anyone else like to weigh in?
I'll chime in. Hi, everyone. So for me, I think health and wellness really boils down to balance. And I think we've been hearing that in the previous definitions as well. I think trauma has a very heavy impact on all the systems of the body, from physically, emotionally, and mentally. And I think health and wellness for individuals with complex trauma is first understanding the imbalances or impacts that trauma has in one's life, and then exploring maneuvering through it all to move towards more healing, harmony, or balance.
I love what Bradel said about balance and what Sarah said about not looking at fixing a problem, because I think, especially for individuals who have sustained trauma, but even just socially as a whole, we look at fixing problems or how to, the idea of what's wrong with me instead of how has something that I've experienced impacted me and what kind of imbalance has that experience caused. And so with the trauma-informed perspective of yoga in particular, the concept is you are whole and you are perfect just as you are. What you have sustained, what you've experienced has caused an imbalance that you're just trying to come back into balance or into equilibrium with by exploring different types of tools and options to help you get there.
Hi, I'm Jessica. I just want to expand on all these good things that are being said. So a huge part, I practice acupuncture, and so a huge part of practicing Chinese medicine is that it is very much similar to how Shiva is saying. It's a mind-body approach, right? You're looking at the whole, you want to sever that disconnect and encompass the mind and with the body. So much of your emotions you're wearing on your body in different ways. So I think it's important that the main focus of Chinese medicine is that you're trying to look at the root of the problem and not just the symptoms, because especially in the way that healthcare is now, there's a protocol to treat this world of symptoms, right? Whether it's pain, whether it's GI stuff, and there's always some protocol for it, but you're just kind of band-aiding it. You have to really get in there and get to the root of why are we having these symptoms in the first place. And so definitely when you're dealing with survivors of human trafficking, really addressing that trauma, there's a lot in those roots that you have to dig up and get to. Otherwise, you're just going to continue to wear that in your physiology and wear that in your body. So I think all these holistic approaches are very beneficial to the survivor because they're really addressing where you're wearing those traumas and where you're wearing and how they're showing up and how they're manifesting in a physical way.
I was going to add to that. That's a great comment. I think there's been a lot of very important points made, so I don't want to be redundant, but a lot of the work that we do here focuses on what we call secondary and tertiary prevention. Patients have already come to us having had a trauma, and so the injury has already been done to their physical and psychiatric well-being. And so what we're looking at is identifying trafficked persons as they come for services, maybe for other medical conditions or other social needs. And so that identification increases access to interdisciplinary providers early on. And so when we think about health and wellness, our goal is to really reduce harm. So how can we bring together treatments, medical treatments, mental health treatments, allied health treatments? I don't use the word alternative, I use the word allied because we work together. And so, moving towards a harm reduction model to improve longitudinal outcome across medical conditions, mental health harm, as well as psychosocial and legal recourse.
Great. So health and wellness for survivors goes beyond some of the more well-known health issues that most people are familiar with. Even though the United States invests quite a bit of money in health, we don't have the best health outcomes compared to other high-income countries. Your responses make me think a little bit about the social determinants of health. Can you all share what this concept means in the work that you do?
I'll start with that answer. So social determinants of health is a very popular topic right now in healthcare and in health systems and in research. The original sort of space around this comes from the world of the ACEs data that comes from Kaiser. And I know that that's going to be something that we discuss later, so I don't want to get ahead of myself. But what we look at is how an individual's social circumstances impact their risk for harm, their health outcomes, and their access to healthcare to mitigate that harm. We know that a lot of patients who are under-resourced and have high vulnerabilities to social determinants of health may have more vulnerabilities to medical and psychiatric outcomes, even if they're not trafficked or traumatized or harmed. Unfortunately, we also know that there's data to support an increased risk of interpersonal and sometimes violence in patients that may be marginalized because of these social determinants, and whether that marginalization is homelessness, unstable housing, comorbid substance use disorders, chronic medical conditions, poor access to transportation, and under-resourced. Those social determinants make people vulnerable to trauma. And so those are the kind of intersections that we look at. And we also know that those same social determinants become a barrier to wellness, so that if those determinants aren't addressed after patients have been identified, that they can't return for treatment. And so the social determinants are not only sometimes a comorbid vulnerability, but can also be an element of barriers to care that impair people from getting the care that they need, even when that care, whether it's medical, mental health, or social legal services, getting access to those services.
And when I think about health and wellness for survivors as it relates to social determinants of health, trauma and adverse child experiences come to mind. And there's been a lot of research that with the consensus that trauma is stored in the body. So can you all speak to that? I know we've kind of touched that topic a little earlier, but maybe dive a little deeper.
Sure, I can speak to that a little bit. I also wanted to add a little bit to the social determinants of health. Dr. Gordon did a great job of kind of, summarizing everything into a nutshell. I just wanted to add one more thing to it. So as she mentioned, this is the intersection of where all the things meet. So we're talking about things like gender and gender identity, race, socioeconomic status, education level, language skills, transportation, food security, and a host of other factors, and how all of them can be barriers to access to healthcare and equity and healthcare in general. And with Yoga for Change and our mission, the way we've been addressing that through the trauma-informed yoga piece is by serving marginalized populations that would otherwise not have access to the benefits of yoga. Because as we know, going to yoga classes at a local studio is an economic barrier because of the costs for attending a yoga class or having a monthly membership, for example, that a lot of the 4 populations that I mentioned would not have that additional income to be able to have access to yoga. So that's how Yoga for Change has been addressing that barrier as far as those social determinants of health are concerned. And then regarding the adverse childhood experiences and how trauma is stored in the body, there is a fantastic book that we require all of our teachers to delve into and read before joining our team. And it's called The Body Keeps the Score by Dr. Bessel van der Kolk. And he does a fantastic job of delving deep into why and how trauma can be stored in the body. And I think something that Jessica mentioned a little earlier was around how different things that might be stored in the body present in different ways. So it could be GI issues or constant migraines or headaches and things like that. So some of it can be connected to something that is going on an emotional and a mental health perspective, and then it's manifesting itself in the body. So The Body Keeps the Score does a fantastic job of delving into that and getting into kind of the science behind how all of that works. And then there's another book too I can recommend. It's called The Polyvagal Theory by Stephen Porges. And he delves into just one nerve, the vagal nerve that connects. It's a connection bridging between your heart and your brain. And it's absolutely incredible how that one connection has such a great impact in the body on all levels between your mental health and physical health, and how those two things are connected with one another. I'm not an expert on either one of those topics, but what I can speak to is that I've seen in my experience the way students that come to our classes initially, when they start off, they're in a very fight or flight mode of where they can't sit still, they're constantly having to move, or they have a really hard time even softening or coming to a place of being grounded in the class. And then and that's because they're in that fight or flight mode, they're in the sympathetic mode because of the trauma they've sustained and because of the way the trauma has been expressing in their body and the way it's living in their body. And then over the course of time, once they have come to a few classes and learned different types of techniques to help calm their sympathetic system back to the parasympathetic system, and they're able to come to a place of peace and tranquility. It's just incredible to see. And that's, again, just one tool that I can speak on from my perspective.
I'm going to also, sorry to take a step backwards with the questions. There are a couple of papers about social determinants and the impact of social determinants on human trafficking. I'm going to email that to the group to be shared with the audience. And most of the work is done out of Southeast Asia. And the research illustrates that of the social determinants of health that adversely impact risk and then care for trafficked persons, many of them aren't being addressed in these populations. Our team actually also wrote a paper recently on this in the Menninger Bulletin on social determinants of health and how that impacts caring for trafficked persons. So I'm going to share those resources with you guys as well.
Those are two great book recommendations, like probably two of my top picks ever. So I'm going to second those. I am not going to add a ton here because so much has already been said, but I think coming from the mental health lens on this, I think historically, particularly in our American healthcare system, we have seen a dichotomization of mental health versus physical health, right? We separate out this false dichotomy of mental versus physical. And everyone here on the panel, I know, shares this view of this is an integrated thing. The mind is the body is the mind. So just to kind of put that plug in there from the last question around the idea that trauma is stored in the body, trauma is stored in the mind and the body, and that is because the mind and the body are one. And so I think that when that lens informs the way that we think about health and wellness from that larger definition where we started, it just makes sense that these things are integrated. So that's just my brief answer.
And I'm going to piggyback on what was said by Dr. Helms. I think that's very accurate, that integration of treatment is of illness and treatment are very important. Some of that data, like I mentioned earlier, does come from the ACEs study in the American Journal of Preventative Medicine. That's the original 1998 study that looked at the mechanisms by which adverse childhood experiences influenced health and well-being. And we know that this is a lifetime event. And so we know that there's historical trauma, local context, and social trauma, ACEs, like we were mentioned, and how that trauma not only impacts mental health harm, but longitudinal medical conditions, including delays in neurodevelopment, social, emotional, and cognitive changes, increased risks of increased adoption of high-risk behavior, and then longitudinal morbidity around diseases and disability related to everything from autoimmune diseases, endocrinologic and hormone pathways, cardiopulmonary diseases, and GI illness. We also know that these sort of traumas can early death longitudinally along populations. The original ACEs study was actually expanded to a study called the Philly ACEs study that actually looked at community trauma and not necessarily just trauma in the home. So environmental toxins, community violence, things like poverty, that looked at how community experiences also impacted health. So I'm happy to send those studies along to you guys as well.
Great. Well, thank you for sharing your perspectives on health and wellness. When survivors are being exploited or first exiting, it seems like there are so many unmet needs. Bradel and Mollie, this question is for you two. What health needs are most critical for survivors during the period in the process of exiting?
Thanks, Deborah. I'll say some of the basic health necessities, getting a physical exam, sexual health, OBGYN, and because they're exiting, such complex trauma, certainly mental health counseling, those are, I think, some of the core health needs there.
Yeah, I'm going to agree. I'm going to agree with that comment. We know that that health-seeking behavior drives survivors of trafficking to emergency rooms, urgent care centers, adolescent health clinics, obstetrics, OB-GYNs, obstetric and gynecology clinics. Actually, dental clinics are actually very high on that list, and then mental health. And when we think about health outcomes related to trafficking, a lot of that work is done by Kathy Zimmerman out of the London School of Hygiene and Tropical Health. She's a public health PhD. She's not a clinician, but she's a public health researcher that looks at medical harm and health outcomes in trafficked persons. And when we think about health outcomes, we think about it in sort of three categories. Number one, was there a health event that predated the trafficking, a psychiatric illness or a medical condition that predated the trafficking, and did that person lose access to care because of the trafficking experience, and were underlying medical and psychiatric illnesses neglected? Then we think about it in sort of the second category of harm incurred during the time of trafficking. So maybe there was physical violence or emotional violence or sexual violence that occurred by a trafficker or a buyer, or in a labor field. Remember, we want to be inclusive of all forms of trafficking, not just sex trafficking. And so did harm come to an individual in the context of trafficking, and what was the violence that occurred, and what were the physical outcomes of that event? And then we think about sort of post-trafficking psychiatric harm, and then this wraps into the sort of the chronic illness of trauma. Is an individual now left with chronic medical and psychiatric sequelae from the trauma, or are they now adapting in maladaptive way? Are they not coping with the trauma and adapting in maladaptive ways with things like substance use disorders that are now newly developed since the trauma has occurred? And I'm happy to send you some of the work of Kathy Zimmerman that looks into detail about those studies.
Thanks, Bradel and Mollie. So Sarah and Jessica, what are some of the long-term health needs of survivors?
So definitely from a Chinese perspective is that you want to be able to continue to and encourage the patients to move their qi. Qi being your vital energy source that's through the body, with the blood nourishing all the muscles, cells, ligaments, tissues, organs. So moving the qi isn't just through acupuncture, although that's a huge source. You can do that through various forms of body work. Yoga, Shiva could attest to that, I think. Chiropractic, massage, exercise, just something promoting movement within the body. Because when you're not moving, that energy becomes stuck and stagnant, and that's what gives rise to these physical ailments. Another influence, just to kind of piggyback on that stagnant, that energy isn't just the physical parts of it too, is that in Chinese medicine, there are all these different associated correlations with the meridians and the organ systems. And one of the major ones are emotional. So when you're carrying these emotions are affecting the body in different ways. For example, if we're looking at, say, grief, and somebody who is grieving and there's a loss, it doesn't even necessarily have to be a loss of a person. It could be a material loss. It could be a loss of home. It could be a loss of oneself, autonomy. That grief is so directly associated with the lung energy in Chinese medicine. So somebody who has that chronic grieving, that chronic loss, will soon develop a weakened lung support, upper respiratory issues that might give rise to, asthma, allergies, things like that. Whereas if you're looking at somebody who is always more anxious, nervous, worry, always looking over their shoulder, that kind of emotion wears more on the spleen and stomach meridians. So those will strongly develop things like GI upsets, and there's a world of GI problems, right? So I think definitely continuing that smooth flow of qi, doing it through some kind of body work, and definitely addressing some of those stuck emotional patterns, those unresolved issues, just kind of going back to how trauma is stored in the body, not just trauma, but emotions in general. That's directly affecting the physiology of the brain and the body. So, for so long, everyone was just thinking mental health and emotions was just in your head, kind of like what Dr. Helms was saying, of kind of identifying that dichotomy, when it's not. You're wearing that on your body. So definitely identifying the emotional patterns and stress blocks, definitely doing some kind of body work. Also, I think nutrition is really important. I think just learning and promoting basic nutrition, whether it's proper hydration. I mean, how many of us are walking around dehydrated all the time? Proper nutrition, proper hydration. And then I think self-love is a big thing. And I think that comes from having a sense of faith, something bigger than yourself, whatever that picture looks like for you. And I think that when you have that, then you start to develop a sense of worth and a sense of self-love. And I think that's what can fill and start to repair that heart space that's been broken.
That was an awesome answer. That was like really comprehensive. I'm not sure there's a ton left for me to add to that, other than I'll just say, when I think about trafficking, ultimately what I think about is the dynamics of power and control, and the way that has been weaponized against people, and the way that impacts their mental and physical wellness. So in thinking about the long-term health and the long-term plans for how to move survivors to where they are trying to move, is thinking about empowering and co-creating what that long-term plan should look like. And there are huge exhaustive menus of options that survivors may want to pick and choose from. A lot of them Jessica just named, different modalities of equine therapy, nature therapy, art, music, traditional sit on a couch therapy, yoga therapy, right? There's an infinite number of things we could populate that menu with. And so I think to answer the question of long-term is how we bridge that gap from the acute phase of exiting to the long-term vision of growing and building that health plan.
Thank you both. So Shiva, what does health and wellness look like for survivors in rehabilitation facilities, or even when they're incarcerated?
Thank you, Deborah. Great question. So with Yoga for Change, just so the audience knows, we go to the locations of our partners and teach on location. So with incarcerated individuals, we go to detention centers, and then with rehabilitation, we go to those facilities and teach students on location, on site. So from a healing through trauma-informed yoga perspective, this is very much dependent on how much a survivor decides to invest in their own healing journey. And I find that often in rehabilitation facilities and in detention centers, there's always a handful of students that are resistant to participating in a yoga class. And that's mostly because of some misconceptions around yoga, which we as an organization have worked really hard to change. So we always have a mix of those who are really engaged and look forward to participating in a class, and then some who are present, but they're hesitant, and they're kind of scoping out what this yoga thing is all about, right? And I find that quickly changes after just a couple of classes, when students start to experience something that both Dr. Helms and Jessica touched on, which is that experiencing empowerment again. And the empowerment in this case comes from syncing your breath with intentional movement. And we talked about how movement is healing. And so you're moving that chi that Jessica mentioned through your body, and you are the one that's in control, and you're the one that are, like I mentioned, you're syncing your breath with your movement, and you're moving your life force through your body. And those breathing techniques that are taught in our class are really powerful, and that's where that empowerment comes from. So just through these exercises, survivors can engage their parasympathetic nervous system. So they might come in, into class feeling really anxious or angry, feeling some really strong emotions, feeling trapped, feeling disempowered, feeling even in a physical way, different types of, headaches, or their stomach doesn't feel that great that day, or they're cramping, or whatever the case may be, back issues, neck issues, tension here, tension there. And so when they come to class and they start to engage in these exercises, they're disengaging from their sympathetic system that I mentioned earlier, that fight or flight mode, and they're engaging their parasympathetic nervous system, where they're going into that rest and digest mode. And all of that plants a seed for starting that healing journey. And as I mentioned, I always say to students, we're here to offer something to you, and you get out of this experience what you decide to put into it. And again, that's still empowering, because you're leaving that decision up to that individual, and you're not coming in trying to force anything on anyone that when they're not ready to receive it.
Great. I love how all of these different pieces are intersecting one another. And even though you all come at this from, different professional perspective, it's really interesting to see the synergies. And also, I am now totally aware of how tight my shoulders are and how I've been ignoring it. And I'm sure this is the case for all sorts of folks who work in this field as well. I mean, we are also kind of these secondary victims of trauma and having to work with people. So I'd like to just pivot a little bit and ask all of you, what are some of the best practices from both a conventional and an alternative or allied approaches that you are seeing in health and wellness? I'd like to hear a little bit about the work you do in each of your lives and in your professional roles. What are some of those, emerging best practices that are coming forward that we are probably likely to hear more about in the future?
I can go ahead and start. I think one of a big barrier to mental health approaches and reaching out for these resources is the different biases and stigmas people have when it comes to mental health, right? So I think a best approach is normalizing the need to take care of your mental health. And so something that I think has been going on generation by generation, and also certainly through the pandemic, is this breaking down of stigmas related to mental health and various approaches to mental health, which is also normalizing the need to take care of that and to access these various approaches, including ones that are I don't want to say alternative now either, but less commonly spoken about or used.
So I love that I think Mollie mentioned, and Deborah, you sort of alluded to this shift in language from calling these alternative therapies to some other term. And I don't know the magic word for that, but I try to avoid the use of alternative as a label because I think it sets us up. Language is powerful. And so if we're coming in and saying to people who we're working with, hey, let me recommend this alternative strategy to you, it already has othered that profession or that tradition of healing, right? And so to really, I think some of the best practices I'm seeing are to really be open to the idea that healing can come in many different forms and to not do that othering of really well-researched, well-supported modalities that can really be helpful for folks. So reducing some of that stigma. And when I say stigma, I don't just mean around mental health, which is obviously an issue as well, but really the stigma around seeking out any other forms of wellness that can really be beneficial.
I love what Dr. Helms said about looking at more than one option, and that definitely speaks to just us as human beings and how dynamic we are and how there's just so much diversity among so many people to where acupuncture might work really well for one person and another person may not. It's just not for them. They don't like needles, for example. So for me personally, I've found a lot of relief, just regular, back pain, chronic back pain that I had suffered from for years. I found a multitude of different types of modalities. Modalities is a word I like to use. I like the allied approach as well. And those include yoga for one, of course, and then chiropractic care, herbal medicine. And then there's also a sister science to yoga that's called Ayurveda, which is not very well known in the West, but that's been really very impactful for me in my life and my lifestyle. And the core idea with Ayurveda is that your health is very much tied to digestion and having a strong, robust digestion. And that is both coming in from digesting food and physical digestion, and also digesting emotional things and processing those things. So one guideline, I don't like to call them rules, but one guideline, for example, is not to have a heavy dinner or eat dinner any later than 8 o'clock in the evening. And what that does is it allows you to allow your body to digest what you've ingested for sustenance, and then come later in the evening, once you wind down, and let's say you're in bed by 10 o'clock, which is another guideline, then between 10 and when you might wake up 6 or 7 in the morning, that's a time where your mind and your psyche is digesting the experiences of the day. So those are some of the minimal guidelines. Other things are around eating seasonally and looking at food as medicine, and looking at plants and different types of properties that they have, healing properties that they have, that can really support your digestion, along with any kinds of other aches and pains and things that you have going on. So that's one way I've integrated all these different types of modalities in my life that I've enjoyed a really wonderful impact and positive health. And I can say I'm probably the healthiest I've ever been in my life. And it took a while to get there, but you learn as you go, and you kind of cherry pick what works for you.
I just want to add one more thought about that, because when we start to free ourselves up to see food, sleep, nature, all of these spaces as holding the potential for healing and wellness and growth experiences, it really is empowering for individuals to know they can access that all day long, every day. If I meet with someone for an hour a week, that's 1 hour a week. But if they know that they can step outside and feel the sunshine on their face any time of day, any day of the week, it just translates that to a more natural and organic way of receiving the healing powers and opportunities that are around us in our daily lives, without that sort of medicalization of it has to occur in this frame, it has to occur in this setting, it has to be that sort of remediating a problem model that we're trying to move away from.
And I was going to offer a resource that there's a team actually at Harvard called the Institute of Nutritional Psychiatry. It's run by a psychiatrist and a chef. Her name is Uma Naidoo. And she brings together a lot of the sort of randomized control trials and the literature around dietary changes for all sorts of mental health conditions. So psychotic disorders, mood disorders, trauma disorders, anxiety disorders, et cetera. And it's a play on This Is Your Brain on Drugs. The title of the book is called This Is Your Brain on Food. And it's a very nicely written summary of the research in this space on the intersectionality of mental health and nutrition, but also in the space of nutrition as a resiliency factor. We talk often about how do we build resilience in clients who may be vulnerable to exploitation or harm, or who have experienced trauma. And resiliency is not just psychological. It can include all forms of well-being, including things like nutrition.
Okay, thank you. I'm feeling like we all need a self-care day talking about all these different modalities to achieve health and wellness. These all sound great, but I think we also have to acknowledge that even basic healthcare can be hard to access. So to all of you, what are the barriers for survivors when it comes to health and wellness? And what is it that hasn't been named yet? I think that one of the pieces that that we haven't really talked about to a great extent is the access to care issue. And so I'd like to include that in the conversation as well.
I know a big piece of it. I'm sorry, go ahead. You can go ahead.
So I think one of the...
I know a big piece of it.
Okay, go ahead, Jessica.
I was just gonna say, the accessibility. I know for me, because I do practice the acupuncture, you would think that because for something that's so ancient and traditional and doesn't require a lot of fancy equipment or a lot of things, But the fees for acupuncture can be very expensive. It can be very costly and it can be very expensive, I think, as a whole, when you're looking at going to get these services as a whole. And it's sad because then it's kind of just targeting this one social class when we all could benefit from it. I remember when I was in school, I used to say, one day I just want to be able to treat everybody for free. Like, why isn't this just part of like free healthcare? Why can't we do, everybody should have the same opportunity to it. So when I started working with survivors, I started realizing not only obviously the cost being an issue, but transportation. So many people who are coming out of a trafficked lifestyle, again, whether it's labor or sex trafficking, you know, they have all these charges and they have all these felonies, and a lot of them don't have a license, let alone means to a car. So getting into their appointments became a challenge. So I feel like transportation costs, making just these, what were we saying? Allied, different modalities, not just affordable, but accessible to people who've been trafficked. I think it really has to involve some partnerships. It really has to. And so I think like Shiva, what they do is great is they go to them to be able to practice and do the yoga. And I think that's lovely, recognizing not everybody will be able to do that, but things like that and developing those partnerships, I think, are important, because just getting from point A to point B sometimes I feel like is an obstacle in itself, let alone having the means and the resources to be able to, you know, to pay for these services.
I agree with Jessica's comments about cost and transportation being barriers to care. I think one of the things that, maybe the only good thing that has come from COVID, is an increase in telehealth resources. And we actually wrote a paper about the use of telehealth resources in human trafficking, because we found that once we switched our clinic to telehealth during COVID, suddenly our attrition rate, which was nil. I mean, patients, we were getting about a 30% dropout rate for outpatient appointments, and suddenly 99% of our patients were coming to their appointments because they could do it from their kitchen. And I think there's some things that can be, I don't think acupuncture is one of them, unfortunately, but I know that there's some areas where telehealth can be translated into other spaces, like yoga and the sort of, I don't want to say social media, but the electronic platform and availability of some of these resources has been a big change in access to care, at least in the last 5 years, with the advancement of technology. So despite transportation and financial costs and, you know, insurance coverage and all these other barriers, technology has really come in and tried to fill that gap at a very rapid rate.
So the comment about technology and also, you know, bringing services to people kind of starts the conversation about how we can make a difference today. And immediately my mind goes to, you know, what are some of the opportunities for those of us as professionals from a funding perspective? You know, has there been an openness in terms of the work that all of you are doing to look at providing support for survivors in this way? Or is that an additional barrier that we are also facing?
I have some strong feelings about that. We're a grant-funded program, so I have a lot of very strong feelings about funding, because we are an entirely grant-funded clinic within a hospital system. I think the answer is actually yes, because one of the reasons that a healthcare approach to human trafficking works is because it fills the gap where the prosecution approach fails. HTI data supported that only about 18 people last year were prosecuted in the state of Texas for trafficking. And if we look at estimated epidemiologic studies, I mean, at the most conservative, there's potentially 300,000 people who are trafficked in the state of Texas alone. So there's this marked gap between the prosecution model and the need for services for victims of violence. So I think that there's a lot of opportunity when it comes to a healthcare approach to trafficking from both federal government, you know, Violence Against Women, Office of Victims of Crime, Office of Trafficking in Persons, as well as like foundational support. A lot of local foundations that are interested in trauma, in violence against vulnerable population, in mental health, in comprehensive services for trafficked persons, I think offer an opportunity to fill that prosecution gap.
One other barrier I wanted to touch on that I think is kind of escaping all of us right now is just the knowledge or education of being informed about what's even available, what's out there, what these different modalities are, and what they have to offer. I know, search engines and Google are assumed to be at your fingertips, but one way I can think of addressing that barrier is the local library, right, is a wonderful resource that's underused. And so having access to a librarian even, and going in and asking the question of, I'm interested in different types of modalities for health and wellness. What information is there available for that? Would you suggest any kinds of books, or how can I find out more about that? Of even knowing to do that, or that the library is a place where you can go and search for information. I think that's maybe readily one of the first barriers of just, you don't know what you don't know.
Okay, so as we're entering our last half hour, we're going to take a quick break, and I'm going to turn it over to Shiva, who's going to take us through a little technique here that may help us all make it through the next 30 minutes.
Sure. So I'm assuming everyone is seated. And if you're seated, go ahead and check in with your alignment. Bring your feet flat onto the ground underneath you. Spread your toes wide. Check in that your knees are aligned with your ankles. Take both fists, put them together, bring them down to your knees, and check in to see that your knees are in line with your hips. So now we're feeling pretty aligned and some, open some space here. Begin to come to the edge of your chair and lengthen your spine, strengthen your back. Begin to bring some space between your shoulder blades. Check in with your shoulders. Go ahead and shrug them up to your ears just to get a point of reference. Release and bring them down, rolling away from your ears and down your back. Feel free to keep your gaze steady at a point in front of you, or close your eyes if you feel comfortable to do so. And check in with your breath. What is the rhythm of your breath like in this moment? Begin to intentionally increase your inhale, and we'll go 4-second inhales and exhales. So we'll inhale for 2, 3, 4. Exhale, 2, 3, 4. 2 more rounds. Inhale, 2, 3, 4. Exhale, 2, 3, 4. And begin to move your shoulders with your breath here. Inhale, 2, 3, 4. Roll them up. Exhale, roll your shoulders down. 2, 3, 4. 2 more rounds. Inhale, 2, 3, 4. Exhale, 2, 3, 4. Last round. Inhale, 2, 3, 4. Exhale, 2, 3, 4. Take a moment here to bring your breath to a natural rhythm. Check in with how you're feeling, and groundedness of your feet underneath you, and the support of the chair. Begin to flutter your eyes open if they've been closed. And we'll come back to the screen.
Thank you, Shiva. I wish you were here in Tallahassee.
Maybe I'll make a road trip.
Okay, so I have one more round of questions for all of you, and then we'll go into questions and answers for our participants. So in an ideal world, what would seeking out health and wellness look like for survivors? How would the movement of our healthcare systems look different? So let's picture, what we would like to see rather than what we would see, and how does that differ?
Well, I think our health systems need to address trafficking the way we address other forms of abuse, neglect, and violence. So elder abuse, adult abuse, child abuse, domestic violence. And there's still this gap where trafficking isn't considered part of that differential. And so with patients who are victims of other forms of abuse, when they come to healthcare systems, they're connected to medical resources, mental health resources, social and legal resources, and other systems and programs in the community that can help support them. So if we think about models of care for things like HIV or chronic medical illnesses, we have community organizations, we have nonprofits, we have healthcare providers, we have yoga instructors and acupuncturists and lawyers and shelters and all of these places that help to take care of patients with HIV, but we're not doing that when it comes to care for victims of violence in the same manner. So we want to, increase our standard of care to approach other forms of violence management and health and community systems.
So I like that, increasing of care, but also integrating it, making it more integrative, not sticking to the same traditional, okay, well, let's try you, we'll get you set up with, a caseworker, we'll get you set up with maybe a counselor or something like that, because I think kind of even what Shiva was saying before, not every modality works for every person, and that's everybody as a whole, not just survivors of trafficking, right? So do you know how many times people have come to me and said, no, I've tried talk therapy and that doesn't really help me. Well, no, I tried chiropractic and I've never really gotten anywhere with that. And my advice to you is keep trying, you'll find it. There's a modality out there for everyone. There are enough modalities in this world that, there's a lot of healing that can be taking place. So I think trying to integrate all these different modalities and offering more than just one service, because then there's that defeat of well, I tried that and that didn't work for me, and so I guess this is it for me. This is where I tap out. And that's not true. There's so many different things, whether it's just even something as basic as proper nutrition and things you can do on your own, spending time in the ocean, spending time in the nature, or actually going out and getting these different types of therapies and different modalities. So definitely living in a place where there's way more these advanced body techniques and there's way more of an integration for whole body healing.
I agree with both Jessica and Dr. Gordon in that, I think it comes down to having information on all the different modalities, right? I think Deborah, you touched on that earlier. It'd be great to just have know what they all are and be able to. And I think Shiva, you talked about that as well, about what each one has to offer. And then with Dr. Gordon, you mentioned that having more partnerships for those resources. I think would be ideal, right? Because right now it's coming down to what partnerships you have, people that can offer these resources for free for individuals who've experienced violent crimes. So yeah, if we had more of those resources that also address the barriers like transportation and are trauma informed, I think is really important to have that component as well.
So integration was my key word as soon as you were talking about this ideal vision. But if I'm understanding the question correctly, we are speaking to an ideal. So this is my magic wand moment that I get to just build something great. So if that is the case, I'm going to really shoot super high and say, this should not just be for identified victims or survivors. This should be for everyone. This should be at the level of prevention, at the level of social and systemic change through far greater reaches than just integrated healthcare for people who identify as survivors of trafficking. And so often, in my experience, at least, survivors do not necessarily identify as victims or survivors at the very beginning. This is a process that occurs through the healing journey. So making sure that when we're talking about building and growing these integrated and all-encompassing systems of care and health and wellness, to make sure that these are really accessible to all people.
And I'm going to add just my own 2 cents here, and that is that we really don't have a system of care for this population. If you think about, services for seniors, individuals with disabilities, individuals with some serious mental health illnesses, our children who are in the Children and Family Services Center, all of those have systems of care. And it appears to me that, with the wealth of funding that we have seen coming out of the federal government, it's all just kind of put out in ways that isn't necessarily looking at it from a systems perspective. We've got things over here and things over here. And how do we, if I wanted to envision the future, I would like to see, systems of care, particularly when you're thinking about people who've undergone, sexual violence and trauma. So that would be a huge piece on my wish list. All right. If no one else has any comments, we can move into our question and answer phase. And this is, if you haven't put your questions in already, please use the question and answer, the Q&A Zoom feature, to pop in your questions. And I'm going to start at the beginning. How is trauma-informed yoga different from other types? I'm going to put that out to both Shiva and Bradel.
Sure. Yeah, I saw that pop in earlier, and I'm glad we saved it for the Q&A. So trauma-informed yoga is a few things. That's from Yoga for Change and what we do. It's a couple of things. One is to always meet your students where they are, and that every class is about empowerment and accessibility. So it's going to be different from a studio class to where, a studio class might be a power flow, and you're going to go get your cardio on and get a good sweat on or whatever. It's more, okay, you show up to a class at a rehabilitation facility, and you have someone who is 4 months pregnant and expecting. You have someone with shoulder issues, you have someone with knee issues or lower back pain. And it's about how to create a flow in a class to where you're meeting your students where they are and what their needs are in that moment. It's not about, I created this whole sequence beforehand and I'm just going to go ahead and teach this regardless of who's shown up and what they need. So that's first. Second, it's different and around languaging. And there, again, there's this concept of empowerment and the way that the class is cued and from shape to shape, and even talking about the word shape. We don't refer to the yoga as poses or postures, because certain words can be triggering for survivors of trauma. So we, for example, would address it as shapes instead of poses or postures. So just a very kind of particular type of languaging around empowerment and ensuring that you're not going to trigger anyone with the way that you're cueing a class. And it's not coming from a commanding space. It's more coming from this is a suggestion. Everything I'm offering you is a suggestion, and you have the sovereignty, the decision to either try this shape, or if it doesn't feel good for you, or you're not, this is not accessible to you, here's how you can modify this shape to where you are getting the benefit out of what it has to offer. So those are just a couple of things around what the trauma-informed perspective means and what trauma-informed yoga means. And at the end of the day, it's about, again, like I said, meeting your students where they are, and not coming from a space of I know everything and I'm the teacher and you're the student. It's more I'm here to offer a gift, and everything I'm offering is a suggestion, and you're not forced to do anything you don't want to do. So I hope that answers your question.
Yeah, there's not a single thing I would add to that. I think you put that out there perfectly and wrapped it with a bow. But I definitely think highlighting the choice of languaging and offering that autonomy for them to choose different shapes and different variations as well.
And are you aware of any virtual options for individuals seeking to practice trauma-informed yoga?
Yes, we have a calendar of events on our website. It's y4c.org. And on that calendar, we both have all of our in-person yoga classes that are in the community and open to the public, as well as some virtual options as well. And I think that's the silver lining of COVID, to where we shifted to virtual platform altogether. And then eventually we went with a mix of in-person and virtual options as well. So accessibility is it's a free-for-all. It's open to anyone from anywhere really being able to access trauma-informed yoga. We also have a fantastic YouTube channel full of a ton of resources. We have chair yoga, we have meditations, we have breathing practices, and different types of yoga sequences that are focused on lower back or shoulder or what you name it, it's on there. So if you go to YouTube and subscribe to our to our channel, Yoga for Change, you'll be able to access a lot of the resources for free.
And you just mentioned, meditation, and other formats. We've had a question about, are there any other types of practices other than yoga that would be helpful to survivors?
Is that question around physical movement or?
I think, or yeah, physical movement or any other types of practices.
Sure. So one other thing I wanted to mention about the yoga piece is it's not necessarily always going to be on a mat. There is such a thing as chair yoga. We did a little bit of it earlier, but there are entire classes and sequences you can do in a chair, from a chair at your desk, if you're taking a break from your day. And other movement, I mean, there's so many things I can get into here. There's different types of meditations. There's shaking meditation, where you would be standing in place and you literally just, kids do this sometimes. They just shake their hand or their shoulders or their body and just, get that nervous energy out. There is Osho meditation. It's OSHO. That's another different type of meditation that has a couple of different phases, and it's also involved in movement. That's not necessarily yoga. There is yoga nidra, which is kind of like a yogic sleep, to where you're resting on the ground, on the mat, or whatever comfortable space you want to be in. You could even be laying in your bed and doing yoga nidra. And there are apps that can guide you. As a guided meditation that's basically a inventory of body from head to toe. And nidra is spelled N as in Nancy, IDRA, yoga nidra. That's the type of yogic sleep. And one of the apps that I like to use is Insight Timer. There's a ton of free resources on there, to include workshops and webinars around a lot of the topics that I covered as far as yoga and movement is concerned. So I hope that answers the question, but yeah, there's a lot out there.
Great.
I was just going to add, I don't know exactly where the question was coming from, but in addition to movement-based options, there are also breathwork-based options. So there are breathwork certifications out there, and there are professional facilitators and coaches who specialize just in the breathwork side and not in the physical movement side of yoga. So that's also an option.
And there's also just a wide variety too of movement therapy to look into.
Great. So another question is, how does one identify that someone may be experiencing or have experienced some type of trauma without the person saying so verbally?
I don't know if this is just my lens and my own bias coming in as a trauma therapist, but my baseline assumption about pretty much everyone who I ever see in the world is that they have experienced some type of a traumatic thing at some point in their life or will. So for me, maybe that over captures a few people here and there who have very fortunately not had some type of a traumatic thing happen. But in general, I think that when we just approach the world from an understanding of the space that most likely there is something that has happened here, then we kind of just move through whatever we're doing, whatever modality it is, whether it's, therapy or yoga or anything, interacting with someone in the grocery store from a trauma-informed space of just approaching people through that lens. I think that just sort of shifts the way that we think about how we interact in general. There are obviously lots of protocols and screening tools and things out there. So depending on, I'm not sure exactly like what the person's setting is or what their ultimate goal is in identifying the trauma. I would also just say in terms of the work that I do, I never come with an assumption that someone needs to necessarily share with me what the trauma is or was. I think there's a lot of good work that can be done without ever having to talk about that specific thing. Certainly for some people, talking about it is an important part of their healing, and that may happen with me or that may happen in other settings. But just to know that whether or not I know what the specific piece of that traumatic story is sometimes not necessary, I guess, to the healing process.
Those are really good points, Dr. Helms, especially about really the sort of original trauma. I tell my students often to be cautious about asking questions that are because they're curious or because it's going to change clinical management. And sometimes as people or even as clinicians, we're curious. And that can be more distressing to patients than treating the symptoms that we see. And patients can present in a variety of manners. I sort of think of trauma as being really internalizing symptoms or externalizing symptoms. So maybe somebody is very expressive to the outer world in their behavior, actions, and words that may indicate that they've experienced traumatic events over their lifetime. And then sometimes you see the opposite. Maybe people, I don't want to say the word shut down because that seems a little bit more dramatic, but maybe they internalize the experience more and are quieter about it. And so there's, of course, a broad spectrum between those two presentations. I think it's important to consider that sometimes they don't psychologize their symptoms, they somaticize their symptoms, and they may not present to a mental health provider. They may present to an acupuncturist or a yoga instructor or a gastroenterologist way before they arrive at a mental health provider like a psychiatrist or a psychologist. And so that's, again, one of those important reasons that an integrated care model served survivors of trauma. So those are just my 2 cents.
So kind of a related question is, what are some good resources for explaining the concept of trauma and negative past experiences manifesting physically? Anyone have any thoughts on that?
Could you repeat the question?
Yeah, so what are some good resources for explaining the concept of trauma and negative past experiences manifesting physically?
I think some of those books that have been mentioned are very good ones, but clients may not want to sit down and read, 300 pages of The Body Keeps Score. So maybe NAMI, I'm actually wondering if the National Alliance of Mental Illness has information about that. I can look that up. We often cite their handouts and pamphlets and flyers. But even working with a provider that is informed about the relationship is a good start, about the relationship between somatic symptomatology from trauma. Let's see if I can pull something up real quick.
There's some really great podcasts out there too. There's one, I cannot think of the podcast name right now. It's is it Waking Up? I'll have to look it up. But there's a podcast with a fantastic Iyengar yoga instructor who also has his own center up in Minnesota, I believe. His name is Matthew Sanford. He, when he was, I believe, 12 or 13 years old, was in a very traumatic car accident, and he sustained injury to his spine and became paraplegic. And we, Yoga for Change, we had a yoga teacher training with him to where he was teaching 25 yoga instructors in a room on how to teach yoga, and he's in a wheelchair. It was just incredible. And he touches a lot on that concept called the subtle body, which is a lot of what we talked about today about that connection between mind and body and the way that they're interconnected and the way that things manifest physically in the body and while they're being stored in the mind, and they get stored in the body just as well. And so he touches on this concept called the subtle body and how to access that through yoga practice. And on that podcast, he delves a lot into that question of trauma. What is trauma? How is it stored in the body? And then, how is it addressed? I'm going to look up the podcast name. I can't think of it right now, but that one's a fantastic one.
So just to keep us, recognizing that there needs to be equal access, one of our participants mentioned that the word yoga is not very popular in her community of Black Americans because the root of it is considered to be of a spiritual unknown to them. And so it's going to be really important for us to make sure that we are also thinking about kind of those cultural intricacies that are there and looking at alternatives for that. Shiva, I saw your hand pop up.
Yeah, this is something I touched on a little earlier about, some of our students hesitating or not wanting to participate in the yoga classes because of some of those misconceptions that we worked very hard as an organization to debunk. And I actually have found that the same of what you mentioned with the our audience member mentioned. For example, we were at a high school and we were teaching a class to teen girls from the African American community. And I asked that question and around, what are some of the misconceptions around yoga? And one girl raised her hand and shared that, I've been told her that it's a sin. And I thought, well, that's very interesting, how and how, where is that coming from? Where is that conception coming from? So we discussed it a little bit. And what I want to come back to is that with Yoga for Change and that trauma-informed perspective, again, it's also around providing a secular type of movement practice. And there's no chanting. We don't use Sanskrit or any kind of even what are called mudras. Those are shapes you might make with your hands and your fingers, and keep it very secular for all of those reasons of those misconceptions around that yoga is some kind of religion and we're trying to recruit people into this cult or religion or something to that effect. So it boils down to yoga is a modality that guides you on how to sync your breath with movement, similar to the short exercise that we practice together here before the Q&A. That's what it boils down to.
So there are some questions relative to the percentages of success in holistic care. What are, in terms, you're all very involved, and I think people are often wondering, is this, how do you explain to me whether or not this is going to have success? And especially when people may be skeptical about other modalities other than traditional medicine. And since you're all involved in that, I'm sure those types of questions come up at a variety of different times. Jessica, I'm thinking acupuncture, is probably one area where you see that questioning the effectiveness and skepticism.
Oh, that's a constant question. That is a constant question. It's always on my radar. So, I mean, I think acupuncture is one of those things. Nothing is foolproof. Nothing works 100% of the time for 100% of the people. So personally, how I practice is when I am establishing with a new patient and I'm getting to know them, and depending on what they're coming for, you know, I do an assessment, like a Chinese medical assessment, to say, okay, let's give it this many amount, like X amount of treatments, not that X amount of treatments is going to have you cured and I'm some magical miracle worker. No, but are we change? Are we seeing a difference? You know, and so I think if yes, then okay, let's keep going on. But if after this amount of time we have seen no difference, then okay, maybe this isn't the right route for you. You know, but as far as the initial question is, as far as successful is it? Well, I think my first question is like, what's your gauge of success? What does that mean? All my problems went away. You know, does that mean my pain's gone? As far as I'm not living with the ailments anymore. But I can tell you that acupuncture is because you're working on identifying the root of the problem and not just the symptoms. When somebody comes in for a chief complaint, more times often than not, they'll start to notice a dramatic improvement in other areas of their life, other avenues of their health per se. So, you know, I might have someone who's coming in and they're coming, you know, for GI upset, you know, maybe they have chronic constipation or something like that. And as we're working on the constipation throughout the process, all these other issues are being addressed and corrected, that have become so normal for the patient. It just becomes a normal way of living for them that they don't notice the change until changes start to happen. So they may be coming in and yes, their GI function is improving, but also they're like, oh, you know, I'm also sleeping better. I also don't feel as anxious all the time, or I'm really noticing a lot more energy and things like that. And again, it's all kind of going back to that. It's a whole body approach. We're not just saying it would be easy for me to treat just your neck pain. Would we have some positive results? Sure, we would. Would they be long-standing? Probably not. Probably not, because we're not addressing why is the pain there in the first place. Because chances are the neck pain is just the ailment. It's not really the problem, right? It's just an extension of what the problem is. So I think that question, how successful is it? I don't really know what that means. Does that mean you don't have any more ailments? If we're talking from a, you know, like a trauma, or from a survivor, somebody who identifies as a survivor, does that mean like, do they fall back to the lifestyle? I don't really know how to answer that as properly. So I'm just trying my best. But as in general, overall, acupuncture can be very effective in treating many different Western diseases. I think the NIH has an entire list. It's like over 50 different common Western diseases and ailments that acupuncture has proven time and time and again with science and research effective treatment for. Drug-free, that kind of thing.
Well, I want to be respectful of everyone's time. For those questions we didn't get to, we will work on getting you answers after the webinar concludes. I want to just thank you all for participating today. We wish you a productive week. And if you have any further questions, you can follow up with the team at Voices for Florida or contact me or any of the panelists. We'll be sending out contact information shortly. So on behalf of Voices for Florida, thank you for joining us, and we look forward to seeing you at other webinars. Have a good afternoon.